Your eyes can tell you a lot about your health. In fact, the famous saying, "The eyes are the windows to the soul," couldn't be more accurate. This is because the appearance of your eyes can point to different health conditions in your body you may not be otherwise aware of. It's of immense importance to pay extra attention to your eyes and to notice any changes in their color, shape, or how well they see. Not only for your internal body health, but also for your eye health. In fact, most people consider their sight their most important sense. In 2016, a study published in JAMA Ophthalmology found that 88% of participants viewed vision to be the most vital sense they have. So, in this video, we will reveal to you 10 things your eyes can tell you about your health. Stay tuned because most people are surprised that number 10 isn't normal. Now, without further ado, let's get started. Number 1. Yellow eyes. Yellow eyes are a strong sign for a condition called jaundice. We will tell you what that is in a minute. But first, you should know that the average lifespan of a red blood cell is 120 days. After that, they are broken by the liver, spleen, and bone marrow because they become old and unable to do their function effectively. Products of this breakdown are recycled to form new red blood cells, except a substance called bilirubin. Bilirubin is transported to the liver, where it is conjugated, meaning it gets combined with glucuronic acid. This makes it dissolvable in water. Conjugated bilirubin is then sent to the intestines to eventually get removed from the body in stool. Bilirubin is what gives stool its brownish color. However, any disease in the liver can affect the liver's ability to conjugate bilirubin. If bilirubin can't be dissolved in water, then your body won't be able to excrete it. It'll then accumulate in different areas in your body, including the eyes. The accumulation of bilirubin is known as jaundice. This accumulated bilirubin will stain your eyes yellow. Examples of liver diseases that can cause jaundice are hepatitis, cirrhosis, or liver cancer. Number 2. Bulging eyes. Have you looked at an old picture of you recently and thought that your eyes are bulging a bit now more than before? Bulging eyes are medically known as exophthalmos or proptosis. It is when one or both eyes bulge abnormally from the eye sockets. The most common cause of this in adults is thyroid hormone dysfunction. So what causes this hormonal dysfunction? Well, Graves' disease is the most common cause of thyroid gland dysfunction. Graves' disease is an autoimmune disorder that affects the thyroid gland. Autoimmune means that your own immune system attacks your own cells. In Graves' disease, the immune system produces antibodies which mistakenly bind to receptors on the thyroid gland. This leads to overproduction of thyroid hormones, which is a condition known as hyperthyroidism. Another manifestation of Graves' disease is inflammation and swelling behind the eyeballs, causing them to protrude. This is because the immune response also targets the muscles and tissues behind the eyes. When this tissue swells, it pushes the eyes forwards, causing them to bulge. Number 3. Dry eyes. Almost all of us have experienced dry eyes before, and all of us can agree on how annoying it can be. But did it ever occur to you that dry eyes can help the early detection of a more serious condition? Dry eyes can be associated with diabetes, thyroid dysfunction, and autoimmune diseases. An autoimmune disease characterized by dry eyes is Sjogren's syndrome. Your eyes are normally kept moistened by tears produced by your tear glands. In Sjogren's syndrome, the immune system mistakenly considers normal body glands as foreign invaders and attacks them. This immune response leads to inflammation and damage to the glands, including tear-producing glands. This results in decreased tear production and poor tear quality. Consequently, those with Sjogren's syndrome commonly experience dry eyes, along with other symptoms such as dry mouth, difficulty swallowing, and joint pain. Number 4. Red bloodshot eyes. Even though red eyes are incredibly common these days, however, it wouldn't hurt to get yourself checked by a doctor if they have been persistent for a while now. Red eyes are a classic symptom that accompany multiple viral diseases like the flu or COVID-19. They have also been found to be present with hormonal diseases such as thyroid diseases and autoimmune diseases like rheumatoid arthritis, lupus, and multiple sclerosis. But what do all these conditions have in common? They all induce inflammation, which is the cause of red eyes. Inflammation causes the small blood vessels on the surface of your eye to become enlarged and filled with blood. This makes them visible to you. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Blurry vision. If objects in your vision field appear hazy and shaky, it could be an indication of a more serious underlying condition. A common cause is diabetes, which causes a condition called diabetic retinopathy. Diabetes is having elevated blood sugar levels in your blood. The problem is that high blood sugar levels can damage your blood vessels, including the small ones in the retina. And since the retina is the light-sensitive tissue in your eye responsible for vision, any damage to it will affect your vision negatively. In this case, it'll cause blurring of your vision. Number 6. Night blindness. Night blindness is having difficulty seeing in dim light or darkness. It can be an indicator for deficiency in vitamin A. Vitamin A is essential for forming rhodopsin. Rhodopsin is a pigment in your retina that helps your eyes adjust to dim light. Without enough vitamin A, the eyes struggle to adapt to low light conditions, leading to night blindness. Now, this vitamin A deficiency can be a cause of a malabsorptive disease, such as celiac disease or Crohn's disease, where the body can't properly absorb nutrients. Number 7. Sudden vision loss. Sudden vision loss is truly a scary symptom to experience. It could mean that your retina suddenly stopped receiving blood. Remember that your blood provides food and oxygen to your cells. Without them, your cells can't function. But what can cause your retina to suddenly stop receiving blood? This would happen if the blood vessels supplying your retina become occluded by a blood clot. This blockage may point to an underlying systemic vascular disease, such as atherosclerosis or hypertension. Furthermore, it would mean you have an increased risk of a brain stroke. A brain stroke is when blood vessels supplying your brain become blocked. This can be fatal. Number 8. Double vision. Your doctor may refer to double vision as diplopia. Double vision or diplopia is when you see two images of a single object instead of one. It can occur when your eyes are not symmetrically aligned. This will cause each eye to form a different image, and so you'll end up seeing two images instead of one. Double vision can be a symptom of neurological disorders affecting the nerves that control eye movement. Conditions such as multiple sclerosis, brain tumors, or strokes can affect the function of these nerves, leading to misalignment of the eyes and double vision. Number 9. Rings around the cornea. Your cornea is the transparent layer at the surface of your eyes. It covers your pupil and the colored part of your eyes, which is the iris. The presence of rings around the cornea is medically known as arcus senilis or arcus cornea. It's seen as a white or grayish ring that forms around the edge of the cornea. If you have elevated levels of cholesterol and triglycerides in your blood, chances are they will accumulate and deposit around your cornea, leading to ring formation. Having elevated levels of cholesterol and triglycerides in your blood is alarming because it increases the risk of countless heart diseases, including atherosclerosis, hypertension, and coronary heart disease. Number 10. Dark floating figures. Did you know that seeing dark floating figures in your vision field isn't as normal as people think? These can appear as spots, specks, or cobweb-like shapes floating around your visual field. Even though they're mostly harmless, they can reveal other serious hidden conditions. One of the most serious conditions indicated by floating figures is retinal detachment. Retinal detachment is a serious condition where the retina is separated from its normal position. This disrupts the blood flow reaching it. This condition poses a substantial risk for permanent vision loss. Dark floaters, accompanied by flashes of light and a curtain-like shadow in your peripheral vision, can be warning signs of retinal detachment. Immediate medical intervention is necessary to prevent vision loss. So, these were the 10 things your eyes are trying to tell you about your health. It is crucial to never ignore any of these warning signs your eyes can give you. Now, we want to hear from you. Did you ever or anyone you know experienced any of these signs before. What was the cause? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.